What does scoliosis pain feel like, and what are the symptoms associated with scoliosis? The pain associated with scoliosis is a biomechanical pain. It is a pain associated with the abnormal structure of the spine. Think about it. We live at the bottom of a 15-mile high column of air, and it has mass. It's pushing on your head all the time. You don't feel it. You're like a fish in the ocean, doesn't feel the water, unless you wave it at yourself, but it's there, and it's pressing down on you all the time. Now, if the spine is straight, well, we were built to deal with that. But if you have a scoliosis, let me just grab a model here. If you have a scoliosis and the spine is tilted like that, that gravity is pressing down, and it's pressing down and it hits the body in two main areas. One is across the lower back, and oftentimes the sacroiliac joints will start to fail because of that gravitational strain being more on one side than the other. And the other area that commonly will show pain is in between the shoulder blades. And the reason that this is going to show pain is because this is where the rib cage is twisting. Remember now that the ribs are attached to the spine. So as the spine twists like this, the rib cage has to twist with it, and that area where the ribs are attaching to the spine gets very stressed. So pain is going to be across here in what's called the sacroiliac joints, and usually in the shoulder blade area. In a typical scoliosis, it's going to usually be more on the right side, a little bit less on the left side, because of the way that the ribs are being twisted into position. Now, we have an effective protocol to take care of people like this. The treatment is to stabilize the sacroiliac joints, and this can be effectively done through scoliosis-specific exercises, and sometimes we require a specific type of bracing called a sorolla belt, which is going around the hips to lock them in. Fortunately, the very nature of this kind of ligament that holds the pelvis together is that if we align the pelvis and then lock it into position, the ligament will shrink and the pelvis will become stabilized over a period of even a couple of weeks. Usually people don't need to wear these belts for more than a couple of weeks. I say to them, keep it in the car. Use it if you're going to do gardening, or you're going to make a Costco run where you're going to do heavy lifting, then it has an application. The pain that's in the shoulder blade area, we're adjusting through therapy, through exercises, and through chiropractic spinal alignment. And we're very effective at getting people out of pain. This is the most important thing. Let's talk a second about what are the signs of scoliosis. We talked about symptoms, pain levels and so forth. Obviously, I should add that there's also stiffness associated with scoliosis because people lose one of the ranges of motion. Like say, for example, they have a curve going to the right, they're going to find it more difficult to bend to the right because they're going against the curve. If they go with the curve, they can move easier. So this is one of the ways that we can identify the scoliosis in the physical examination. But the signs of scoliosis are, how does it appear? What does it look like when somebody has scoliosis? You're often going to see a shoulder elevated. And why? Again, the rib cage. As the spine tilts, the rib cage has to go with it. So the whole side of the body is going to be dropped down. We're going to see one hip extending out. Why? Because the spine is twisted and it's going to push one hip out. We'll often see a shoulder blade sticking out. So when the person bends forward, and again, it's all about the rib cage. As the rib cage rotates back on the right side in a typical case, the shoulder blade is going to be sticking out. And this is especially prominent when the person bends forward. We're going to spend some time talking about that in another video about how to specifically evaluate your child to see, do they have a scoliosis? This is something that we teach the parents because we have many parents that have scoliosis and their kid has a mild case. Now they're very worried. What's going to be? Is my child going to develop the same condition that I have? So we want to get that child in here as early as possible. We want to teach the parent what to look for, and we show them to evaluate the child. Waist, hip, shoulders, shoulder blade, all these things together give us a picture of what's called the signs of scoliosis. Thanks for watching. I hope you found all this information helpful. Please subscribe if you'd like to have more information about scoliosis, and don't forget to hit the bell. That'll alert you whenever we publish new information. And if you've got any questions, write them in the comments field, and I'm going to make sure to address them in a future video. Thanks for watching.